Hello everyone. The topic of the presentation is dyslipidemia. I would like to thank Dr. Sangme sir and Dr. Raina madam for their continuous support and guidance. So let's begin. The headings that will be dealt here are introduction, causes, clinical presentations, classification, lipids and coronary heart disease, treatment, samprapti and Panchakarma treatment in Staulia. What is dyslipidemia? It refers to the imbalance of lipids such as cholesterol, low density lipoprotein cholesterol, triglyceride, high density lipoprotein, either from organic or non organic cause. It is an extremely important condition, principally because of its contribution to atherogenesis, and it is an independent and modifiable risk factor for CAD. Causes of dyslipidemia, or we can say the types of dyslipidemia, they are primary and secondary. Primary dyslipidemia. It is presence of excess levels of lipids in a patient's blood sample in the absence of other underlying condition is called as primary dyslipidemia. The elevated lipid fraction is either cholesterol or triglyceride or both. Single or multiple gene mutations are the primary causes. Secondary dyslipidemia. The causes are obesity, diabetes mellitus, hypothyroidism, renal disorders, liver disorders, Cushing syndrome, and drug administration. Many drugs like diuretics, beta blockers, and estrogens have an impact on lipid metabolism and can result in significant alterations in the lipoprotein profile. Clinical presentations of dyslipidemia are xanthomatosis, xanthelasma, corneal arcus, and lipemia retinalis. Xanthomatosis is deposits of cholesterol seen as yellowish nodular masses which vary in size. Xanthelasma is yellowish plaque lesion seen on the medial aspect of upper and lower eyelids. Corneal arcus. Grayish ring appear along the periphery of cornea. Premature occurrence of arcus has been associated with hypercholesterolemia. Lipemia retinalis. Creamy white discoloration of retinal vasculature. In severe cases, salmon color fundus is seen with extremely high triglyceride levels. As you can see, these are the presentations of xanthomatosis, xanthelasma, corneal arcus, and lipemia retinalis. As you can see, the values of total cholesterol are below 200 mg per dl is considered as desirable, and 200 to 239 mg per dl is borderline high, and more than 239 mg per dl is considered as high. Under low density lipoprotein cholesterol, less than 100 is optimal for people at risk of heart disease. 100 to 129 is above optimum. 130 to 159 is considered borderline high. 160 to 189 is high, and more than 189 mg per dl is considered very high. Less than 40 mg per dl of HDL cholesterol is considered poor. About 40 to 59 is considered better, and more than 59 mg per dl of HDL cholesterol is considered as best. Triglycerides less than 150 is considered normal. 150 to 199 is borderline high. 200 to 499 is considered high, and more than 499 mg per dl is considered as very high. Relation between lipids and coronary heart disease. The risk increases progressively with higher values of serum total cholesterol. Positive correlation between the levels of blood LDL cholesterol and heart disease is much more significant. In contrary, high levels of HDL cholesterol have been associated with a decreased risk of CAD. Low levels of HDL often reflect obesity, smoking, lack of exercise, or impaired glucose tolerance. High levels of triglycerides with low levels of HDL seem to have an increased risk. Pharmacological management of dyslipidemia based on the assessment of cardiovascular risk factors and cholesterol levels. Classification of patients into following groups is possible. First, those with established coronary heart disease. Second, those with multiple risk factors or with genetic hyperlipidemia. Third, those with isolated asymptomatic hyperlipidemia. These groups represent a gradient of absolute risk of coronary event and therefore of the absolute benefit to be achieved by cholesterol reduction. There are several classes of hypolipidemic drugs. Choice of drug will depend on the patient's cholesterol profile, cardiovascular risk, and the liver and kidney functions of the patient. Classes of hypolipidemic drugs include statins, fibric acid derivatives, resins or bile acid sequestrants, Frobucol, Lefebrol, niacin, and lifestyle modification. Lifestyle modification include diet, exercise, weight management, evaluation of alcohol consumption, smoking cessation, and nutritional supplements. Samprapti of Staulya or manifestation of dyslipidemia. Due to various causes as mentioned here, will lead to Medodhatvagnimadya. Production of Saramsha is affected and abnormal production of Pitta Bhagam. Further lead to defect in Medodhatu Poshana, which will end up with the stages of dyslipidemia. This is Samprapti Ghataka. Doshas involved are Vata, Pitta, Kapha, Invata, Samanavata and Vyanavata, in Pitta, Pachaka Pitta, in Kapha, Vedaka Kapha. Doshas are Rasa and Medha, Agni, Medodhatvagni, Ama, Medodhatvagni Mandya Janita, Shrotodushti, Rasava Shrotas and Medova Shrotas. Shrotodushti Prakara is Sangha, Udbhavasthana, Yakrit, Rasadhatu, Sancharasthana, Rasayani, Rogasvabhava, Chirakarik. Panchakarma treatment in management of Staulya. It is divided into 3 stages. First is Purva Karma, second is Pradhana Karma, and third is Paschatkarma, and utilization of different classical yogas. Purva Karma involves Deepana Pachana, Snehapana, and Svedana. Deepana and Pachana is done to stimulate digestion and to remove ama. Trikatu Churna and Panchakola Churna are used. Snehapana, limited Sneha is used in Staulya. Tripaladikrita, Tiktakrita is used. In Svedana, Ruksha Sveda is ideal to liquefy fat. Udvartana and Valuka Sveda is indicated. In Pradhana Karma, Vamana Karma is indicated if Kapha is predominant for Kapha Shodhana. Here, Madanaphala and Vishtimadu are used. In Virechana Karma, it is preferred for Medha Shodhana. Administration of purgative drugs like Trivrat Leha, Avipatika Churna, and Gandharvastadi Kashaya is indicated. One of the important procedures indicated in cases of Staulya is Lekhanabhasti. Lekhanam Shoshayati Cha, scrapes and dries up excessive doshas. Composition contains Lekhana dravyas like Triphala, honey, Saindavalavana, Guggulu, Mustaka, Dar, Haritra, Kutaja. Triphala is an excellent Kapha and Medhara. Honey is Yogavahi and scraping property. Saindavalavana enhances the absorption, and the remaining drugs are common additions. Benefits of Lekhana Basti. It scrapes out excessive Medha, reduces weight gradually, improves digestion and metabolism, clears Srotas, provides lightness, no significant weakness if done properly. One of the most important and effective procedures indicated in case of Staulya is Ruksha Udvartana. It is because it removes excess fat and balances Kapha dosha. The formulations that are used in Ruksha Udvartana are Kola Kulatadi Churna, Triphaladi Churna, Yava Sarshapa, Trikatu and Sarshapa, and Panchakola. Kola Kulatadi Churna is used because it has strong Medhora property. Triphaladi Churna is used because of its mild detoxification and skin tone property. Yava and Sarshapa is having extra scraping property and improves circulation. Trikatu and Sarshapa is used for stubborn obesity, and Panchakola is indicated for deep-seated ama and medha. Paschatkarma. Paschatkarma in Staulya is just as important as the main treatment because it prevents relapse and supports sustained weight balance. It includes following. First is Sansarjana Krama, that is dietary regimen. Second, Patya Patya, that is do's and don'ts. Third, Rasayana, that is rejuvenation therapy. And fourth is the classical formulations. First one, Sansarjana Krama. It is gradual reintroduction of food starting with Deya, Vilepi, Yusha, Mamsarasa, and light solid food, that is Laghu Ahara. Light, easily digestible, low fat and low calorie diet is preferred in cases of Staulya. Emphasis on Laghu, Ruksha and Lekhana properties in food is preferred. Second is Patya Patya. Patya is the regimen that has to be followed and apatya is a regimen that has to be avoided. Patya, ahara having lagu, ushna, ruksha guna has to be followed, and dravyas like takra, madhu, yava, mudga, kulata, masur, ushnodaka, tilataila and sarshapataila is indicated. In apatya, ahara having guru, snigdha, madhura guna should be avoided, and dravyas like goduma, masha, tila, tugda, ikshu, grda, dadi and madhuraphala has to be avoided. Third is rasayana. After detoxification, that is after pradhana karma, the tissues are very receptive. It is the best time to rejuvenate and strengthen them. Rasayana prevents metabolic rebound. Rasayana acts as medohara and lekhana, and it corrects shotavarodha by supporting proper circulation. The different kinds of rasayana indicated in Staulya are Trifala Chuna, Gugulu, Shilajatu and Takra rasayana. The combination of Lagu Patya Ahara, Dinanitya Vyayama and Ruksha Udvartana is very helpful in case of Staulya Chikitsa. Classical formulations that are indicated in management of Staulya. Kashayas are Gugulu Tiktakam Kashayam, Mahamanjishtadi Kashaya, Paradi Kashaya, Pranadi Kashaya, Tiktakam Kashaya, Guruchadi Kashaya, Aragvadadi Kashaya, Aragvada Mahatiktaka Kashaya. Vati and Gugulu that are used are Arogyavardhini Vati, Navaka Gugulu, Kanchanara Gugulu, Medohara Vidangadi Loha, Trayushanadi Loha, Navayasa Loha, and Asava and Arishtas are Ayaskriti, Kumaryasava, Aragvada Arishtam, Lodra Asava, Panchakola Asava, and Punarnavasava.